And Dr. Zoller, we had another question. Do you have access to medications in your office? Is that part of your service? Tell me how that works.
Sure. So part of those barriers of primary care are radiology, medications, labs. So what we do is we do offer over 200 medications in our office at steeply discounted rates. The way we're able to do that is we buy wholesale and we distribute, and of course we have software to be compliant with the label and all that. But you know, things like most generic blood pressure medications we can do for less than $1 a month, and we do because we want you to take your pill if it's recommended. Same thing with labs. We have 288 labs and counting. We do on-site, we send out for processing, but most of those are results available the next day.
Because a lot of that stuff is common to most of us, right, when we come in. So how different is this from the way medicine is traditionally practiced, and what do you think this means about where we're headed with the way we finance and pay for medical care?
Well, I think it's interesting in that it's kind of a kickback to how things were 50 to 60 years ago. You had a direct relationship with your physician. If you went to see him or her and you had a problem, then you paid cash or traded a chicken back in the day.
However, do you take chickens? I don't have one, but if I did.
Or it's open for discussion. But I feel that as more and more people, for better or worse, are pushed into cost-sharing mechanism with their insurance, higher deductibles and whatnot, that it's in everyone's best interest to be aware of costs and to try to optimize primary care.
And how does that change the experience for you as a doctor?
It's incredibly rewarding. We found, I still work sometimes in hospitals and whatnot, and a lot of it, and you know, I can say my wife is actually an outpatient physician as well, and in a traditional practice right now. And it's unfortunate, everyone goes, the sentiment is you go to your primary care doctor and they're sitting in front of a computer and it's a quick visit, 5 minutes or less. The doctor doesn't enjoy that. The patients don't enjoy that. But unfortunately, with billing and whatnot, it's the system that we have in place. So by removing all of that and the bureaucracy, if you will, I get to interact with a patient for an hour just practicing medicine, which is very rewarding.
And then finding out enough about them that you make sure you've got the full picture of whatever it is you make a decision about. I can see why that would appeal to you.